Hello, welcome once more to Ask Your Midwife. I'm Patience Efrifa. It's been a long time we had a chat. In today's topic, I would like us to talk about hydrocephalus in newborn babies. Alright, the word may sound big or huge, but hydro simply means water. And the cephalic or cephalus in medicine means the head. Alright, so it's just like water in the head or water in the brain. Anything related to the head is cephalic. Let's take it like that. Now, this hydrocephalus is something that can be prevented. It's preventable. Ask Your Midwife is a program that also helps us to identify things that can be prevented, or from preventing is from occurring. Now, what can prevent one from getting such, or a baby from getting such condition? Simply intake of folic acid. The more reason why when we attend antenatal visits, our midwives gives us folic acid, and we take it once a day. Just some small tiny tablets. You take it once a day. Also, if for it to work effectively, even ideally, not even effectively, but ideally, any woman in the fertile age is supposed to take folic acid as a daily supplement. It helps to avoid all these congenital abnormalities which we see on the wards. Alright. With hydrocephalus, it's a condition which is mostly associated with spinal bifida. And spinal bifida too, it's so funny that its cause is due to lack of intake of folic acid. That is it. So what happens is that it's because spinal bifida is a neural tube defect, then it means that it has a connection with the cerebrospinal cord. So with this, we are talking about cerebrospinal fluids. All right. So when there is accumulation of, ideally the cerebrospinal fluids is supposed to, in the ventricles or in the brain, supposed to be drained in, and then some will come and replace it. That it should be the normal thing. But with this abnormality, what is an abnormality? It's been accumulated in the brain. And in the brain, there's a structure in the brain we call the ventricles. So this cerebrospinal fluid mounts pressure in the ventricles of the baby's brains. Now, when there's pressure in this ventricle by the cerebrospinal fluid, it causes the baby's head to become larger than normal. Causes the baby's head to become larger than normal. And some of the signs and symptoms that you see is that the baby's head already, the first thing is, you realize the baby's head is larger than a normal baby's head. Then the anterior fontanelle, when they say the anterior fontanelle, the easiest way I can explain is I have newborn babies where mothers or those who have seen babies, I believe most of us have seen babies before. The side where you see breathing like it's breathing up and down, this side, the anterior fontanelle, ideally for a normal baby, is supposed to accommodate 2 fingers. That is when you are doing physical examination of a newborn at birth or postpartum or after delivery. Ideally, it's supposed to admit 2 fingers like this when you're doing examination, and then the back one is supposed to admit a finger. That is for a normal baby. But babies with hydrocephalus, you realize that that side, that anterior fontanelle, which you see always going up and down as if it's breathing, always looks larger than normal. The fetal skull at term is supposed to be fully ossified or hardened. But you realize that such babies, their fetal skull are soft. So they have soft cranial bones and they look thinned out. So that is why they are soft. Yes. And then they realize that their forehead looks larger than normal. They cannot look up because of the weight of the head. Their eyes are always sun-setting, just like when the sun is setting, as if it's looking downwards. That is how they look like. They can't sit because already the spinal bifida, it depends on the type of spinal bifida, because we have spinal bifida meningocell, spinal bifida with meningomyelocell, and then we have spinal bifida occulta. These are the 3 types of spinal bifida we have. With some, the baby cannot even sit. Talk less of the baby's head larger than normal. So that means when the baby sits down, if care is not taken, baby will fall down, because baby will go backwards like this. Baby will drop and fall down. So that is how such babies look like. Now, what will cause a baby to have this kind of anomaly? And the first thing I spoke about is lack of intake of folic acid or folate in our diet or in our food. And then we also have an infection. When the mother is pregnant and she's been exposed to any form of infection or an infection, she has a higher risk of the baby presenting with such anomaly. And then we also have excessive production of the cerebrospinal fluid, which I've already spoken about. The cerebrospinal fluid is supposed to be regulated ideally, but when it's excessive, that means there's an abnormality or there's an obstruction somewhere, which is causing this excess one not to be absorbed and causing pressure in the ventricles. All right. Now, how do we diagnose it? Hydrocephalus, simply put, can be diagnosed at the antenatal level. That is why they said, or that is why we always say that as soon as you notice you are pregnant, please make it a point to visit a hospital. Visit a hospital, a health center with well-trained staffs to attend to you, because that is where it can be identified early. That is where it can be identified on time, so that early interventions can be made. Even if it's a health center, a CHIPS compound, which is even identified, early interventionists, they can quickly refer you to a higher level where there are specialists to attend to you. So please, let's not joke with antenatal services. All right. Now, when we come to labor, most of the times, because the baby's head is larger than normal, it's not able to descend into the maternal pelvis. That's the bones in the waist, where the baby is supposed to pass through the passage to the vagina to be delivered per vaginum or spontaneous vaginal delivery. But because the baby's head is big, it looks like there'll be a disproportion, or that's what we call the cephalopelvic disproportion, meaning that the baby's head is larger than the maternal pelvis. So there's a disproportion. So because of that, it will lead to what? Prolonged labor, and it can lead to an obstructed labor. Aside that too, it can cause the mother to have premature rupture of membranes. The membranes can rupture prematurely. Yes. And then because when there are good uterine contractions and the baby's head is still not descending, the woman will keep contracting. And when the woman keeps contracting and care is not taken and the contractions too becomes too excessive, it can cause the woman to have imminent rupture of the uterus. Yes, because as the uterus contracts and retracts, it tries to push down the baby to the lower uterine segment, down to the pelvis. But here lies that the baby's head is big, so that physiology won't take place. So that is the disadvantage in labor, and it will also expose the mother to infections due to her lying in labor or being in labor for too long. Now, how do we treat hydrocephalus? Yes, it can be treated. Hydrocephalus can be treated only through surgical procedure. So when a baby is exposed to, or a baby is having such a condition, then that means that the only way that such a baby can live for long is through a surgical procedure where a VP shunt is passed. The VP shunt is the ventriculoperitoneal shunt. We pass it through the head so that it can regulate the cerebrospinal fluids in order for the baby's head not to grow larger than normal. And one thing I'd like us to know is that as the baby grows, you have to go and change that shunt. And this should tell you that it is expensive. It is expensive. Okay. Now, let's talk about the prognosis. When I say the prognosis, that is outcome of treatment. And we are saying that with the outcome of treatment, approximately 2/3 of infants with hydrocephalus most of the times they do die. Now, you realize that when you deliver, or those who have been to the labor ward, or those who have delivered before, when you deliver, a midwife uses what we a tape measure, like the normal seamstress tape measure. She uses to measure the baby's head, not only the head, including all the body. That measurement is to serve as a baseline monitor, so that during the 6 hours of that's why when you deliver, we don't quickly discharge you. We do what we call 6 hours observation of both mother and then the baby. That 6 hours of observation is a critical period because anything can happen. Apart from the baby, you monitoring the baby, you monitor the mother as well, because she can even go into shock. She can bleed because after the delivery, some of them may. So you have to observe all these things, making sure that she's fine before she goes home. Even the baby, we measure the baby's head. The baby's head measurements have standard measurements. So if there is any deviation, let's say I took the baby's head measurements, hospital-frontal measurement, that is from the occiput to the front, let's say it's 9.5 centimeters. Okay, then maybe I do mental vertical measurement. I did all the measurements, and then during the 6 hours observation, I realized that there are changes. Those figures I had, if the baby's head is becoming big, you realize that the figures will increase. Then she tell you that baby has started having signs of what? Hydrocephalus, and needs immediate care. You get it? So this is how hydrocephalus is. So if we don't know how it is, then today we've learned. If there is any question, as usual, please don't hesitate to do so. Probably it's not everything that I may be able to put it in a video, but if you have any further question, kindly do so, because the topic is Ask Your Midwife. So if I do any video that you don't understand, kindly send me a question, a follow-up question, and maybe I may not get the time to answer you on time because I go to work and I come back. But as soon as I see it, I will try and answer the question for you. Thank you very much. You can find Ask Your Midwife on Facebook page. Then you can also find Ask Your Midwife on YouTube. Just go and type Ask Your Midwife, or just type Patience Efrifa and get access to all my videos. And then for those who don't understand the English dialects too, don't worry. I'll start doing the Ghanaian languages for us to understand it better, because that is what I would like to achieve in order to rule out maternal morbidity and mortality, as well as neonatal morbidity and mortality. Thank you very much. God bless us all.